Institut Jantung Negara IJN has organized the IJN Heart Failure Conference 2025, bringing together over 500 cardiologists, researchers, healthcare professionals, and policymakers to discuss solutions and strategies for better heart failure management. The conference, held at the Kuala Lumpur Convention Centre, is themed Advancing Global Collaboration in Heart Failure Management. The three-day event features keynote addresses, expert panel discussions, and interactive sessions focused on improving heart failure care.
Our heart failure team, under the guidance of Dr. Azmi, has been doing a great job, in which this heart failure conference is an example. This is the second time that we are having this for the nation, and in fact is going international this time.
The management of heart failure is expanding, and of course, there are new technologies, and some of the technologies are not available in Malaysia. And I think it is great for us to collaborate, with the international partners, everywhere in the world, because we'll be able to learn and also advance our technology. And of course we can be able to learn, they will be able to learn with us as well, in terms of technology that we have. So it is very, very important. In the last 10 years, I think a lot of changes has been made, whether it is a medical therapy in terms of medication, whether it is due to a technology in terms of transcatheter therapy, and also at the same time the advancement in terms of the heart transplant and mechanical circulatory support. A lot has changed over the last 10 years, and I think it is great, and I think it's good for us to have this conference, because this conference is actually for us to platform, to show what is available in Malaysia and also everywhere in the world as well.
One of the highlights of the conference is the IJN's Heart Failure Module, a digital solution designed to empower patients and transform heart failure management. Integrated into the IJN Care mobile application, this feature provides patients with a heart failure care guide, self-examination tools, and a video library.
The IJN heart failure modules will allow patients to be able to handle this disease back home. So they will know when to weigh themselves, to see whether they are drinking too much, to know their blood pressure, to know their pulse pressure, and to report symptoms that they are experiencing. So when they come back to see the doctor for the next appointment, the doctors and the team will go through all these findings with the patient to advise them on what are the things that can be improved upon, so that the heart failure became stable.
This is a 2.5 days conference. We actually put a platform in terms of all range of treatment for heart failure, starting from diagnosis, the treatment, the management of patients. So we actually platform all the treatment available in Malaysia, including all of it in IJN. And I think it's a good platform. Doctors can learn, they can participate in terms of the case discussion, and hopefully they can bring back home to their hospital the knowledge that they have from this conference. The treatment research are actually looking at the management of patients with heart failure with preserved ejection fraction, which is a newer or subset of heart failure that is currently evolving in terms of the management. And also the other research that we are also embarking is genetic study. Genetic in heart failure is one of those things that we always want to embark, and it's a new technology, and this is something new that we're actually approaching in IJN as well.
Globally, heart failure impacts 64 million people, and Malaysia had one of the highest heart failure prevalence rates in Southeast Asia. Through initiatives like the Heart Failure Conference 2025, IJN is working to address these challenges by promoting early detection, adherence to treatment, and better management of comorbidities.